significant progress, and as you can see in our weekly vaccination progress report, we're accelerating our number of daily shots in arms. Our current 7-day average is now 3 million vaccinations per day, up from 2.9 million last week. 3 million vaccinations per day, and this includes the lower volume days around the Easter holiday. And as the President announced on Tuesday, all adult Americans will be eligible for vaccination no later than April 19th. That's in 10 days and ahead of the original May 1 timeline. Our vaccination program is working. It's accelerating, and we're on track to meet the President's goal of administering 200 million shots in his first 100 days. This is only possible because of our whole of government response and the aggressive steps we have taken to get more vaccine supply, more vaccinators in the field, and more places for Americans to get vaccinated. However, we know there's more work to do. That's why we're accelerating our efforts to get more safe and trusted places for Americans to get vaccinated and meet the President's goal that by April 19th, 90% of Americans have a vaccine site within 5 miles of where they live. First, on the federal retail pharmacy program, as we expand to more pharmacies, millions of Americans are able to get their shot at their local pharmacy the same way they get their flu shot. Today, there are around 30,000 pharmacies participating in the program. That's an increase of over 70% in less than 2 weeks. And we are on track to meet the President's goal of nearly 40,000 local pharmacies by April 19th. Second, on federally run mass vaccination sites, our mass vaccination sites located in some of the most underserved neighborhoods in the nation are run and staffed by FEMA and DoD personnel in close partnership with state and local officials. And these sites have a combined capacity to administer 110,000 shots per day. On March 29th, the President challenged us to open at least a dozen new sites by April 19th. We've brought 9 online in the last 10 days. And today we're announcing 2 new sites in Tulsa, Oklahoma, and Baton Rouge, Louisiana. Third, we are making progress on meeting people where they are. More than 500 community health centers are already receiving vaccine directly from the federal government. These community health centers serve nearly 30 million Americans. 2/3 of community health center patients live at or below the poverty line, and 60% are racial and ethnic minorities. As we announced earlier this week, we're expanding our community health center vaccine program so that all of the nearly 1,400 community health centers can sign up to receive and administer vaccines. Overall, across the country, there are now more than 66,000 sites where Americans can go to get a shot. And by April 19th, we will meet the President's goal of ensuring 90% of Americans have a vaccination site within 5 miles of where they live. On vaccine supply, this week a total of more than 28 million doses went out to states, tribes, and territories and through the federal channels. More than enough supply to maintain and increase our current 7-day average of 3 million shots per day. In fact, over the past 3 weeks, we've allocated almost 90 million doses of Pfizer, Moderna, and Johnson & Johnson vaccine to states, tribes, and through the federal channels. And we're working with states, tribes, and territories and our other partners to make sure they are administering shots as efficiently and equitably as possible. Both Pfizer and Moderna are on track to meet their commitment of each delivering a total of 200 million doses by the end of May. And on Johnson & Johnson, the company is working closely with the FDA to resolve any manufacturing issues at the Emergent facility in Baltimore and to secure FDA authorization. Johnson & Johnson is installing a new senior leadership team to oversee all aspects of production and manufacturing at the facility. and Johnson & Johnson will have full responsibility for the operation and will leverage the expertise of Merck as well. Johnson & Johnson expects a relatively low level of weekly dose delivery until the company secures FDA authorization. With FDA authorization, the company also expects a cadence of up to 8 million weekly doses in total across state and federal channels later in April. Importantly, Johnson & Johnson has also reiterated its commitment to provide at or near 100 million vaccine doses by the end of May. Now, even as we accelerate our vaccination program, we are seeing areas of the country where cases are increasing. From the beginning of the administration, we've been closely tracking the data on the state of the disease in each state and territory. The CDC tracks data and outbreaks at the state and county level. Since taking office, we've made this data public, and weekly state-by-state reports were made available for the first time. Our philosophy has been, see something, say something. So when we see metrics trending in the wrong direction, we talk regularly with state officials to offer our assistance, including deploying CDC teams to provide their expertise and resources. With recent increases in cases in some states, we're intensifying those efforts even further. We will be offering to states with significant increases in cases a set of additional tools to help them to stem the spread, including, first, working with states to make sure they are using all of the doses they have received. Today, millions of doses have been distributed, but have not yet been administered as shots in arms. Second, we're offering to surge federal personnel, including CDC response teams, FEMA, DOD, and other federal personnel to support vaccination efforts and get more shots in arms. Third, providing additional testing capacity, including increasing the availability of diagnostic testing, as well as screening in schools and other settings. And fourth, offering more therapeutics and treatments. All of this is on top of the more than threefold increase in vaccines that have gone to all states and jurisdictions since the president came into office. For a medium-sized state, this translates to hundreds of thousands of additional vaccines each and every week. And as is our practice, it's been our practice since the beginning, we make vaccines available to states as soon as they are available. In closing, to be clear, we're working to put this pandemic behind us as fast as we can. But as the president said earlier in the week, everyone needs to do their part. That's why he has called on every governor, mayor, and local leader to maintain or reinstate mask mandates. All of us need to keep up our guard and finish this job. So please, please, wear a mask, socially distance, and get vaccinated when it's your turn.